Hi Year 9 students, for those of you who don't know me, my name is Rebecca and I'm here to talk to you about radioisotopes in medicine. Throughout this video, I will talk about a particular radioisotope, the type of radiation it produces. I will be explaining how the radioisotope is used in the field of medicine, outlining the benefits and problems associated with the radioisotope, and how the benefits outweigh the problems. The radioisotope I have chosen to talk to you about is one that some of you may be familiar with. It goes by the name of iodine-131. Iodine produces two main types of radiation: gamma radiation that can travel an excessive amount out of the patient's body from about several meters away, and beta radiation. This type of radiation travels less than half a millimeter into the tissue. Beta radiation will selectively kill the most overactive cells in the thyroid gland, and gamma radiation will then come in after. Iodine-131 radiation is used in medicine to treat thyrotoxicosis, also known as hypothyroidism, and particular types of thyroid cancers. Iodine-131 is commonly used in therapy to treat hypothyroidism due to Graves' disease. This is when a patient's own immune system is attacking the thyroid gland, causing it to produce too much thyroxine. Iodine-131 is also used for imaging and treating neuroblastoma. In all of these uses, iodine destroys the tissue through the use of beta radiation. There are many benefits for the use of iodine-131. One benefit is the procedure of taking iodine-131. As the iodine is swallowed in a single dose and the capsule is in liquid form, it is quickly absorbed into the bloodstream and it starts to diminish at the gland cells. Another benefit that this radioisotope has is that there is no equipment needed. Each patient gets a dose of iodine-131. This is efficient and for some patients takes the stress and anxiety away of having major equipment placed on them. Problems and risks associated with iodine-131 is the fact that your body will give off a lot of radiation. For some time after your therapy, because of the radioiodine that is used, you will have to remain in the hospital for a few days after treatment and may have to stay in isolation so that others are not being exposed to the radiation as well. The short-term side effects of iodine-131 radiation are neck tenderness, nausea, swelling of the glands, dry mouth, and certain taste changing. These side effects are easily cured by simple things such as chewing gum for dry mouth, etc. Doctors use small doses of iodine-131 to treat overactive thyroid. The problem is that if the dose is not perfect, the iodine-131 can result in causing cancer instead of diminishing the tissue. The benefits for using iodine-131 outweighs the problems associated with radioisotopes, as there is a rare chance that the dosage will cause cancer in the thyroid. Iodine has very minimal side effects and is very effective. The benefits of iodine shows that as soon as the capsule is swallowed, the iodine-131 begins to start diminishing away at the overactive tissue. This provides the patient with a better chance of putting what has happened to he or she behind her and moving on. The main potential problem with an overactive thyroid gland is it turning into underactive thyroid gland by consuming too much iodine-131. However, the likelihood of this happening is below the 30% mark. This statistic shows that the benefits of having iodine-131 interjected into your body is more compelling than the risk and problems associated. Thank you so much, Year 9, for taking the time to watch my video on iodine-131. I hope I have enhanced your knowledge and I've given you some insight into what iodine-131 does for people in the medical field.